So let's continue with the practice, and the topic of today's practical class is drug receptors or pharmacodynamics. So I prepared some questions for you that are in the textbook, and we will discuss them so you can remember the lecture material better. So these are the questions. So the first question is about the drug that is beta adrenomymetic isoproterenol. Is isoproterenol is drug acting on the heart, uh, and it is acting the same as the epinephrine. Epinephrine is the in, intrinsic intra-body, is produced inside the body by the body itself, and also will act on the heart. So the question is, what is the best name for the isoproterenol that is drug? Full agonist, partial agonist, competitive agonist, irreversible antagonist, and inverse agonist. So what do you think?
It's a full agonist because it produced an action.
And why it's not partial agonist?
Do partial agonists produce a reaction?
No, they also produce the same.
They will both produce the same?
Yes, full agonists and partial agonists produce the same. The difference is partial agonists will produce it less, while full agonists will produce it on the maximum amount, the same amount as the natural agonist. Like the epinephrine is natural agonist, and the question tells us that isoproterenol produces maximal contraction. Maximal contractions means that it is full agonist. So it is, if you have partial instead of the maximal, then it will be partial agonist. So actually it's very easy. Full is a maximal, partial is a less than maximal or contraction. It can be not only contraction, so contraction is effect. So isoproterenol is the drug, maximal is the amount, contraction is the effect. Maximal is amount of the effect, contraction is the effect. Epinephrine is the natural agonist. So it's not a drug, it's actually used as a drug, but it's also the natural agonist. So, and what is the competitive antagonist? How you understand competitive antagonist? So we discussed antagonists before, and with you remember the antagonists can be competitive and non-competitive. Oh, anyone here?
Yes, but I'm not sure.
Not sure that you are here still sleeping, seeing dreams, or you're not sure about the answer?
I'm not sure about the answer.
Okay, if you are not sure, still try to respond anything, like what do you think? Competitive antagonist. So you have competitive and you have antagonist. So what means antagonist? So how do you understand antagonist? Maybe someone.
It's
Kulut,
like
Kulut, are you here?
yes, I am, but I don't know the answer.
You don't know? Okay. Rami, Rami, what do you think about the antagonist? What is it? Valeria? So, anyone else here? A hub? No one. Okay, so antagonist is actually the blocker that will prevent agonists from the action. So agonists will bind to the receptor and lead to the effect, while antagonists will also bind to the receptor, but there will be no effect. And moreover, it will prevent agonists from binding to the receptor. That is why it will block the action of the agonist. So actually, antagonist is a blocker. So if you want to prevent the effect, then you use antagonist. So competitive means that the antagonist will compete to bind with the receptor with the agonist. So that means that if the concentration of the agonist is higher, then the agonist will bind to the receptor. If the concentration of the antagonist is higher, then agonist will not bind with the receptor, and this is a competitive antagonist. The um, the opposite is non-competitive antagonist is a type of the uh, antagonist that uh, will not compete. So that means that uh, the concentration is not important. So at any concentration, the uh, the non-competitive antagonist will block the action of the receptor. So let's move to the reversible and inverse. So what is an irreversible antagonist? What do you think? Irreversible, what is it? So most of the drugs actually competitive antagonists. So that is why it's important for you to understand what is competitive antagonist, because about 99% of the drugs are competitive antagonists. So what do you think is irreversible antagonist? So irreversible antagonist means it cannot be returned back. So once it binds, it will not unbind the receptor. So antagonist will bind to receptor permanently, and then to produce an effect, the cell must produce a new receptor. So this receptor is actually will be dead. So usually these irreversible antagonists are not drugs. So usually these are toxins, the uh, and also some uh, poisons. Usually the used in modern warfare. So irreversible antagonists, so like used with the gas attack, and in most countries they are forbidden. So and there is a declaration for that forbids to use that during the war as well. So and the last one is inverse agonist. Inverse agonist is actually what do you think is inverse agonist? We discussed this during the lecture. Valeria, are you still here? Still shy. Valeria, I remember she was shy at the first uh, class on botany, so she's still shy. So what is the uh, inverse agonist? What is it? Inverse agonist.
It's like the same as the agonist, but it produces an inverse reaction.
It will not produce inverse reaction because usually you can't, but it will decrease the effect. So usually agonist will increase, but this one will decrease the effect. So there is no any reaction. Usually it's not. Usually the effect is some response like muscle contraction or heart contraction. So this particular one will act on the heart with increase in the heart rate. So inverse agonist will decrease heart rate, vice versa. But it can be anything, like heart rate is just an example here because the isoprotenerol is the will act mostly on the heart. It will also act on other on vessels, uh, on the uh, arterial pressure, the blood pressure, but uh, in this example we are talking about the heart or cardiac muscle. Okay, let's move to the second question. So second question is about the naproxen. Naproxen is the drug that is analgesic and can be used to treat a headache. So if you wake up today uh, after a long party, if you wake up today at the morning after the party last night and you have a headache, then you can use a naproxen as an analgesic to uh, uh, to uh, to to cure the headache. So to treat the headache, you can also use ibuprofen or paracetamol. So any of these will be effective if you have a headache now. So, but hope you don't. So naproxen produces the same energetic response as the ibuprofen, but naproxen is used 10 milligram while the ibuprofen is 100 milligram. So the what can you tell about the naproxen and ibuprofen if you compare these two drugs? What do you think?
What is the difference between efficacious and potent?
Efficacious means that what is the maximum effect, and potency depends on the EC50,
Depends on the what?
on the effective concentration 50,
Mm-hmm.
EC50. Do you remember we discussed
Yes, yes.
EC50 on with the cubes, and then we
Mm-hmm.
told the lower is EC50, the more potent is the drug. So the lower is the dose that is effective, the more potent is the drug, the higher is the potency. So it is a reverse connection.
Then it's B.
B.
But it's yes.
Naproxen is more potent than ibuprofen. Yes, it's
Mm-hmm.
correct. So actually we can look here. So it's correct. It's also B. So uh, and uh, what do you think? Why is naproxen is not more efficacious than ibuprofen? So why A is not correct?
You just said that if the dosage is low, then it's more potent.
Yes, it's more pointed. So I agree. So this is correct. We already done with that. But now I want you to explain why the A is not correct. So A, the choice A tells naproxen is more efficacious than ibuprofen. So why it is not efficacious? So from this, how do you know that is not more efficacious than ibuprofen? What is the most? What means that more efficacious? What is that? Like, what is the efficiency of the drug? Okay, so what is the efficiency means? How do you understand efficiency?
Like
Like, you get
benefits?
what
Benefits.
benefits? What benefits?
Benefits.
Okay, what benefits?
Like you get the maximum benefit if it's maximum effect.
So what is? Where do you use this efficiency? Not in pharmacology, like in your everyday life. Do you use efficiency? Like,
Has more ethic.
sorry?
Has more ethic.
Mm,
Works more.
okay, but give an example. Like, you have more what? More food, more color, or what? More electricity, or like you can drive longer, or you have less fuel consumption. What is the efficiency? Okay, do you drive a car?
No.
Or Sandy, I know your brother has a trunk, right? Correct?
No, he has a car.
He has a car?
Yes.
Okay, so but so uh is it a modern one or old one?
No, it's a modern one.
Modern. So if you okay, and uh your dad also had a car, right?
Yes.
So I suppose that your dad had a old car, and then it consumed much more fuel to run the same distance. So like
You mean than my brothers?
there, yes, to compare
Yes.
to your modern car. So
Mm-hmm.
and then we now talk about the efficiency. Like, efficiency is when you consume less and you get more. So you can pay less for the fuel and drive long distances. So this is efficiency. Or
Mm-hmm.
like, if you get your phone charger, and like, you can get a cheap phone charger and it will charge your phone, and you can get a more expensive phone charger and it will charge your phone the same, but the cheaper charger will consume more electricity, so then you will receive a higher electricity bills. So, uh, so when you buy a phone charger, think about investing some money into the efficient charger that will consume less energy, so you can save the planet. So you can be more environmentally friendly, to consume less energy, and to prevent to harm nature less. So the same is with the modern cars. Modern cars are designed more efficient, so they consume less oil, and that will harm the nature less. So that is why modern uh, vehicle factories now, companies produce more efficient, so they compete to produce more efficient uh, engines. So this is about
Sure.
the yes.
You are talking about catalysis or efficiency.
I'm talking about the fuel consumption in the car, like, and efficiency of the charger of the phone, not about the catalyzers, because catalyzers are actually also save the nature. So like they are more they make the vehicles more environmentally friendly, but catalyzers are like enzymes. So they what the
Yes, they
catal
use.
sorry.
I say like catalysis. You said about efficiency. They use less energy, but they produce more effect. But like catalysis have the same thing.
No, catalyzers in the car, in the vehicle, they don't. They don't increase efficiency, but they decrease the uh, carbon dioxide, carbon oxide release. Like what they do, they uh, so the catalyzers are installed at the uh, out pipe of the engine. So the carbon oxide is a toxic gas, so like it's not good for the atmosphere and for the human body. So it is uh, react it will react with platinum, and then platinum is catalyzer that will make a reaction uh, uh, with the oxygen, and then it will give you water and carbon dioxide. Carbon dioxide is actually more natural gas because it can be converted back to the oxygen with the plants during the process of photosynthesis, and that is why catalysis will prevent the air pollution. So catalysis is actually, if you remove catalyzer, your engine will be more efficient. So, but then it will pollute the atmosphere. So that is why it's not allowed by the most of the governments. So government will not allow you to drive a car without a catalyzer. So will not give you a permit. So, but this is not about efficiency. This is about, so it's like an enzyme, like but most drugs are not enzymes, so will not act on enzyme. Most drugs are act on receptors. So, and actually when we talk about efficiency, that means that the effect is high, like, so efficiency is ability to relieve the pain. So if its effect is analgesic, then analgesic means that the pain is removed. So if the drug is not removing pain like in 15 minutes, half an hour, then it is not efficient. So the more efficient drug will remove the headache faster, and then will also remove the headache, the more terrible headache. So because headache can be slight headache, can easily be removed, but some headache is cannot be removed easily. So the most efficient drugs will remove head more uh, like more severe headache, and will do it faster. So okay, then what is the full agonist and what is the partial agonist? Full agonist and partial agonist. So when you buy some goods in the supermarket and then you return home and your food is not good, so you are not happy, then you return to the supermarket and claim a refund. So when you claim a refund, then the seller can give you full refund or partial refund. What is the difference? Oh, okay. It's Let's assume that you order address online. So you order address online, then the address will So most of the students are female here. So I think good example for you. So you order a dress, and then the dress is uh, different color. You ordered a red dress, but the seller uh, shipped you a blue dress. So then you claim a refund. So the seller can give you full refund. That means that it will return you all the money you paid for the dress. For example, you paid 50 uh, uh, $50. So and then the if seller will return you 50, then it is a full refund. So but sometimes uh, when you cannot return the dress, then you can keep the dress, but seller will tell you that I give you partial refund, like only 50%, for example. So and then if you agree, then you only get $25 dollars back. So this is a partial refund. So what is the difference between full agonist and partial agonist? Hulud, have you ever bought a dress?
Have I what?
Have you ever bought a dress online?
Yes, a lot.
So how many times you return that dress or get a refund?
Not a lot. I'm pretty specific.
Specific, but you do you have experience of returning dress?
Returning clothes in general, but like, I don't know. I just when I get it, it's the right size and everything for me. It's rarely that I have to return something.
Okay, but have you ever get a refund from the seller?
Yes, and it would be full refund.
Full refund. Okay, good.
Yes.
You are lucky. You get a full refund. So, what do you think is the difference between the full agonist and partial agonist?
It's the partial is not the full.
Yes. So, what is the difference?
Exactly.
So, partial is actually less, right?
Yes, exactly. It's not the full amount.
So, you usually want a full refund.
Yes.
So, the same is in pharmacology. In pharmacology, you usually want a full response. So, you want a full agonist. So, that is why most of the drugs are full agonists. So partial agonist is actually will give you partial response, not the full response. And most of the time you want a full refund and you want a full response as the same. So actually here it's very pretty easy. So same as in the any other situation, you want a full, not a partial. So okay, then the last one. So is naproxen is better drug or than ibuprofen? So what do you think? If you have a headache, you visit a pharmacy and the pharmacist will give you a choice between naproxen and ibuprofen. What will you choose? Rami, what will you choose? Mohammed, Ahmed?
Yes, I think like naproxen is long acting.
No, it's same as ibuprofen. So naproxen is 10 milligram and
Yes.
ibuprofen is 100 milligram. That is the only difference.
Mm.
So what will you choose? So do you think one of these, naproxen or ibuprofen, is better? What is the better for the pain?
I think it depends on the pain. Like it's
But now so I mean, from this explanation, what, because you don't know yet what is the difference between naproxen and ibuprofen. So, but from this sentence, what is the difference from what you see, like 10 milligram and 100 milligram? So, is there any difference between which is better for pain relief? Like, if you were a patient, would you mind taking 10 milligram or 100 milligram?
I think it depends on the pain. If the pain is hard, we take a higher amount, but it's
No,
like short acting.
no, it's same. So like 10 milligram of naproxen will give you same effect as 100
Ah,
milligram of ibuprofen. And naproxen is sold 10 milligram, and ibuprofen is sold only in 100 milligram. So you don't. So there is no connection between this milligram and the effect. That
mm-hmm.
100 is higher than the 10, but that doesn't mean that ibuprofen 100 milligram will be more efficient than the 10 milligram of naproxen. No, they are identical, so they will act the same. Do you
Yes.
think some they are equal or the same, or they are different?
I think they are like equal in amount, but in efficiency, like they are different.
Efficacy is they are equal. They are equal in efficiency. So they will relieve the pain the same. 10 milligram naproxen will act the same as 100 milligram of ibuprofen. So that is why neither of these drugs is better. So
They
the
both are the same.
sorry,
The same? Both are the same.
yes, these drugs are uh, not better than any of each other. So they are the same, identical. So that is why you usually the patient will buy the one that is cheaper. Like if they are same, like everything identical, then uh, usually you should give the patient the cheapest one. So, oh, the patient can ask you to give the cheapest, so to save the money. Like uh, for the girls, the like it's like when uh, you buy uh, a shoes, then you have two shoes that like they look the same. They are both pretty, and then when you can't find what to choose between two, but you have money only for the one, then you usually buy the cheapest one. So you can save additional money for the dress, for example. So then let's move to the next question. So the 10 milligram of morphine produces a greater energetic response that can be achieved by ibuprofen at any dose. Which of the following statements is correct? What do you think?
I think morphine is more effective
Yes, I also think so.
Okay, why? Why you think so?
Because it's said in the question.
No, it's in question. It is they don't say that morphine is more efficacious. It says that it produces greater
Written.
energetic response, so greater effect.
Yes,
So what? Why you think it is? So our correct answer actually E. Morphine is better drug to take for pain relief than is ibuprofen. So what is the efficiency of the drug?
Consume less but produce more.
Consume less, right, but produce more. So,
Teacher,
yes.
how can I, like, if I have these questions, what make me choose E, not choose C, and make me choose C, not choose, like, how can I differentiate between the C and E? I see that they both have the same idea.
No, they are not. So the morphine, actually, that's true that morphine is full agonist, but ibuprofen is also full agonist. So, and the also morphine binds to one type of receptor, while ibuprofen binds to another type of receptor, but they both are full agonists. So
It's
ibuprofen,
so here is mistake in number C.
no, it's not a mistake. So it's actually
It's
wrong answer. So
uh-huh.
not all statements are correct. So this asks which of the following statements is correct. That means only one of these statements is correct. So like the first A is not correct because morphine is more efficient than ibuprofen. So and then B, also morphine is more potent than ibuprofen because we know that the ibuprofen requires 100 milligram from the previous question, and morphine is 10 milligram, so less dose, then it's more potent. It's not less. So B also wrong. C wrong because ibuprofen not a partial, it's also full. They both are full agonists. And also they bind to different receptors. Morphine binds to one receptor type, and ibuprofen binds another receptor type. So that is why they they both are full agonists. Uh, but even if receptor will be the same, so actually ibuprofen. From this statement, we cannot decide if ibuprofen is full or partial, but just uh, most of the drugs are full. So ibuprofen is competitive. Antagonist, no, it's not antagonist, it is agonist. So that is why this is incorrect. It's competitive? Yes, right. So this statement has two parts, competitive and antagonist. Competitive is true, ibuprofen is competitive, but it is not antagonist, it is agonist. That is why D also incorrect. And then you only have E left, so that is why this is correct choice. So better drug means uh, that morphine will uh, have a greater analgesic response. Greater means that will relieve a more potent pain. So if the pain is more severe, then the morphine will be drug of choice. Like you will choose morphine for only for the pain that is very severe, like during the bone bone crack, or after the surgery on abdomen, or when the patient is cancer, or for the cancer patients. Okay, so let's go to the next question. So, is the presence of naloxone a higher concentration of morphine is required to elicit full pain relief? So, naloxone. So, one moment. So, is the presence of naloxone a higher concentration of morphine is required to elicit full pain relief? Naloxone by itself has no effect because which of the following is correct regarding these medications? So when you apply naloxone first, then you need a higher concentration of morphine to get the pain relief. What do you think is naloxone and why? Is the question uh, like clear?
Yes.
So how do you understand the question? So question is, what is naloxone? It's
It
agonist,
has
antagonist. Okay, first, do you think it's agonist or antagonist?
it's an antagonist because it has no effect when it's by itself.
Correct. So now you have only what first left. So and E, A and E. So it's not. Uh, B is not correct now because if you know naloxone is antagonist, B is you can remove the B. So now you naloxone is competitive antagonist. What do you think? Is correct or not? And also you have E,
Think
non-competitive antagonist. So this is opposite. A and E, you should choose one.
it's not A
Not
because
E.
it's competitive.
It's competitive. Why is competitive?
Teacher, wait, maybe because it competes to the receptors.
Yes, but how do you know about that?
It needs another drug with it to work.
No, it doesn't need another drug to work. So do you remember this slide?
Yes.
Do you remember this slide? So and the so this is competitive. So this is non-competitive antagonist, and this is competitive antagonist. So, uh, so if you administer a competitive antagonist, then this response move to the right shift, and when you shift the cube to the right, then to get the response. So this is effect. This is response. For example, you want to get 50%. to get 50% response without antagonist, you need like 10 milligram. But when you, because of this shift to the right shift move, then you need larger concentration now. So, and this is for competitive antagonists. So competitive antagonists will require higher drug concentration. So that is why naloxone is a competitive antagonist, because a higher concentration is required. So for the same full pain relief, you need a high concentration of morphine. So then let's see, morphine is less efficacious than naloxone. Is it true?
It's not mentioned.
No.
No, it's not true, because uh, efficiency is the if the ability to make a full pain relief, but actually naloxone will not get any pain relief. So because it has no effect at all, no effect. Naloxone, that is why morphine is more efficacious. It's not less efficacious, it is more efficacious than naloxone. That is why C is incorrect. Then morphine is less potent than naloxone. Why it's not correct?
There is nothing mentioned about this in the question.
But if you think, what do you think? Is it less potent or more potent than naloxone? Nothing. It's mentioned because naloxone, no effect. So potency is actually when the drugs have the same effect, but you need less dose. But naloxone has no effect, so that is why the morphine will be more potent,
But
because
morphine is required in more concentrations than naloxone.
no, it will not require more concentration.
Here it's in the question, in the presence of naloxone, a higher concentration of morphine is required. So in this case, what is more potent is naloxone because it's a lesser dose.
No, that's so the potency. So in the presence of naloxone, that means that the morphine will the naloxone will not act. It has no effect, but it is antagonist, and morphine is the agonist. And the high concentration of morphine is not compared with the concentration of the naloxone, but a high concentration of morphine is compared with the morphine itself. Like you have a normal concentration of the morphine and the high concentration of morphine, but they both are morphine concentration, not the naloxone concentration. But the potency is when you need less concentration of the naloxone to produce the pain relief. But here naloxone don't have any effect at all, but it modified the morphine effect. So that is why like morphine is more potent than naloxone, because for the naloxone, uh, whenever concentration you use, you will not get any effect, zero effect. So that is why actually this is also incorrect. So it's complex now, especially at Saturday morning. It's too complex for the Saturday morning, really. Okay, let's go. Maybe it's an easy question. Maybe here. So, uh, so the same, penicillin like a naloxone. higher concentration is required to elicit full pain relief. So pentazocine, pentazocine has a smaller analgesic effect, so even at the highest dose. Which of the following is correct? So what do you think is more correct?
Is it B?
Let's see. Why do you think it's correct? Yes.
Because because it has an effect, but it's a small effect, but its effect increases when morphine is given.
No, the effect will not increase.
It's not increasing, but it must be, like morphine must be given with it.
So the effect is less. Like the thing is, morphine has higher effect, and pentazocine has a smaller effect, no matter which dose. Like even at higher doses, even at highest doses, pentazocine will has a, a less effect than the morphine. So that is why it's partial. So it's actually classic partial agonist, so it's pretty easy. So it's not antagonist because it will has some effect, and then efficiency. Morphine is more efficient uh, and also more potent, uh, and actually with pentazocine is not antagonist, so that is why E is not correct and A also not correct. So next question. In the presence of picrotoxin, diazepam is less efficacious at causing sedation regardless of the dose. Picrotoxin by itself has no sedative effect even at the highest dose. Which of the following is correct? What do you think? So has no effect.
So it's an antagonist.
Right, it's antagonist. So we only have to choose A or E. If competitive or not competitive.
I think it's non-competitive because it has no effect, but it has an effect with another drug.
No, non-competitive is not about the effect. Non-competitive is about the dose. And regardless of the dose means it's non-competitive. Regardless of the dose, because competitive antagonist will be not effective. So if the diazepam is, if we increase the dose of the diazepam, then the or if we decrease the dose of picrotoxin, then it will be less efficient. So picrotoxin will not block the diazepam in low concentration, but it says in the presence of picrotoxin, no matter what concentration of picrotoxin is, diazepam is less efficacious regardless of the dose, means it's not competitive. Okay, then let's see what is next. So we have receptors that are free, spare receptors, free receptors. So what is the correct? So the number of spare receptors determines the maximum effect. Is this correct? What do you think? I encourage you to participate because Sandy is and Salma are only one who answer the questions. Then during the I remember who is participating more, and I will like take that into account during the test next week.
We have a test next week.
Yes, we have test next week, so it's revenge time.
Okay.
Revenge time is soon. I'm waiting for that
Mhm.
with a
Actually, I
pleasure.
didn't participate because I just don't know the answers.
So what even if you don't know the answer, what do you think? Think. Pharmacology is all about thinking. So those of you who like to think, so then you will get your answer. If you don't think, so if you don't think, you will never get your answer, or you will never get anything. You always need to think. So if you think much, then you will not be wrong. Khulud, do you think much before the ordering address?
Do I what?
Do you think much before ordering a dress?
Yes.
So and you get your dress right, like the one that you like, you desire, the correct size, and you don't need to return it back because you think
Yes.
much before ordering a dress. So the same
Yes.
here. If you think much before answering questions, then you will get your score high.
I'm just not sure about the answers, that's all. So
Okay,
that's
if
why I
you
just stay silent, but I'm listening and I'm trying to understand more.
Quote, if you are wrong, that's
Hmm.
fine because we're just learning. Because it's not a test, you will not get your score less. So you don't risk anything. You don't need to pay for that. If you choose
Okay.
incorrect answer, then you don't need to return your dress. No, actually we just will discuss why it's not incorrect and then go to the next case.
Okay.
So what do you think? A, B, C, D, or E?
Um. Okay. I think it's. I'm not sure. I think it might be E.
E. Okay, why you prefer E?
Um. Because like it's talking about like. Just give me a second.
Okay, to
Okay. I think it might be
Hulud,
D. I'm not sure.
Hulud,
D. Okay.
I will rephrase this E for you and for other
No,
uh,
I think E is incorrect. I think it's D.
Hulud. One moment, I will rephrase so you understand better. For
Okay.
example, for example, you are studying, so you are in the university in the group, and there are in your group there are several guys, and you so some of them look pretty, some of them look more attractive, some of them look less attractive, and you know that some of them have girlfriends. So my question is, so you know some of the guys have a girlfriend. My question is, will they look less attractive if you know that a guy has a girlfriend?
I think yes.
So when you know that the guy has a girlfriend, then when you look at the guy and he looks less attractive, so not pretty anymore, right?
Yes.
Right? Really?
Yes.
Why?
I don't know. It's just psychological.
Psychology. But okay, but if you don't know that a guy has a girlfriend, but he actually
It would be
has,
the opposite. I think it would be the other way around.
I mean, just you don't plan to date this guy, but just you look at him and if someone asks, is he's pretty or not pretty? So if you know he has a girlfriend, he automatically looks not pretty ugly, or he is still pretty, but just you don't you will not date him, but he's still pretty, right? Maybe
Okay, he's still
maybe
pretty, but I wouldn't date him. Yes.
of course I'm not asking if you date if you will date or
Yeah,
not.
I understand. I'm just repeating like one of
Okay,
the choices that you said.
okay, but still, maybe one day he will be free, and then you can date him. So he will not be less attractive for anyone else just because he has a girlfriend.
Uh
Same is
huh.
here.
Okay.
Same is here. So if the agonist have affinity is attraction actually. So agonist is uh, uh so agonist so receptor is a guy. So receptor is a guy and agonist is a girl. So when a girl has a affection so to the guy, then it doesn't matter if guy is already uh, taken by another girl. So it's same. So attraction will be the same because the receptor, the guy, is a pretty so attractive for the uh, lady. So then a lady uh, will feel attraction, and maybe one time or so next day or next week he will he will be free, and then when the receptor will be free, then the uh, agonist can bind to the receptor. So that is why affinity is like a constant, so it will not depend on the business of the receptor. So if the guy has a girlfriend, that he still remains attractive for other girls, and that is why actually you just need to wait a little. So don't rush to other guys that are ugly.
Okay.
So just wait because sooner or later he will be like uh, free, so you can have your hands on him. So that's very easy. So same is here. That is why this is not correct. So uh, it's not less. It's the same. Affinity is the same. So affinity is not the interaction. So uh, so of course, if the receptor is non-spare, the agonist cannot interact. So you cannot date the guy, but he is still pretty and attractive. Okay, so this is not correct. So then, what do you think, Khulud? What do you think?
Um, D.
D. Okay. Why do you think D?
It's the closest thing that's similar to what you had just explained. I think
So why it's close?
they are active even in the absence. Like it's. I don't know how to explain it. Like.
Okay, let's return to our example. So,
Okay.
how do you think will a guy be happy if he don't have a girlfriend?
Um,
I don't think so.
So if the guy is not happy, then why the receptor will be actually why receptor uh, will be active? Then a receptor don't have a girlfriend. So if receptor don't have a girlfriend, receptor will also not be happy. It will not be active. So the same is here. So if a guy don't have a girlfriend, he is not happy. He will not be active. He will not buy flowers. He will not like walk with a girlfriend to date her. So will not have any attention. So he will not do anything. Just will be unhappy. Same is for receptor. Receptor will not be happy.
Okay.
Okay, that's very easy.
I guess.
So let's go further.
Okay, we're gonna take it like in I don't know in C then.
C. Okay, let's look on the C.
I hope it's correct.
A single drug receptor interaction results in many cellular response elements being activated. Okay, single drug receptor interaction. Single interaction means that the one guy and one girl. So single drug receptor interaction, single drug one girl, and single receptor is one guy.
Okay.
And then this interaction, like this dating, results in many cellular response elements being activated. So does when the guy meets a girl, does this makes a uh, several love loves, like, or they have one love, or do they have many loves when they meet together? Have you ever dated a guy?
Yes.
So when you dated a guy, do you have one love or several loves? Like many loves?
Uh, just this, just the guy, supposedly.
Just one guy, so you shared one love, right?
Yes.
So same here, actually. So single drug receptor. So single drug
So,
receptor. Usually one element is being activated. So one response. So one date, one love. You don't have uh, several types of loves. Love is
okay.
only one.
Well, I don't think it's B. I think the last thing would be A then, if we
Okay,
are
so
looking for.
why you don't think it's B?
I don't know.
Spare receptors are sequestered in cytosol. Receptors are guys, so the spare guys are not uh, sequestered means that joined, like they are kept in the uh, spare guys are not kept, like they don't meet and wait like in a uh, in outside. So you have to search for the guys. You have to go to the parties to find the spare guys. So spare guys will not wait for you outside when you go outside. So
So it's not correct.
uh, so actually spare receptors are sequestered in spare receptors. That doesn't mean spare them or not. They are usually in membrane, so they are fixed on the membrane. So so spare guys, they will not be easy to find, so they will not be inside the university. Actually, you cannot find spare guys because all they already have some girlfriends. So to find spare guys, you go somewhere to the parties. So you have to travel, like to do some work. So that's why. So let's look like, oh, it looks like a C is. So let's actually, for the I think sometimes for drug receptor is different from the guide. So so it's actually yes, it can be many cellular responses, but usually it is one response. I'm not sure why they correct Z here. Okay. So for this pair receptor is actually question is not very clear. So we will get to that later, I think.
Okay.
So for the so for the A, the number of spare receptors determines the maximum effect. This is also wrong. So actually, all these answers are should not very true, I think. So the number of spare receptors will not determine the maximum effect because the maximum effect is only true for the enzyme. So this A true for the enzyme but not for the receptor, because the number of receptors activated is not the same as the max will not necessarily make a maximum effect. So because even if you activate a small amount of receptors, you can still get the maximum effect. So it's like when you date a guy, then uh, if you talk less, you still can get to fall him in love. So you don't need to talk much or to take a lot of time. You don't necessarily need a lot days to make to fall in love. So maybe you only need one date or 2 dates, like it's enough. So so for the spare so for a single drug receptor interaction, so this is like we don't discuss this much during the lecture. So okay, then let's go to the last question, I think. Yes, it's last question. So which of the following would upregulate receptors? So upregulate means that increase in the number of receptors. So I think you already see the answer. It was E. So upregulate means increase in the number of receptors. So anyone still here? How do you understand upregulation of receptors? So upregulation is increase in the number of receptors when there is no response. So when you don't use a drug, then there is no effect, and that is why the body will produce more receptors to allow a response to be. So usually when you don't activate receptors, or when you block receptors, then the body will produce new receptors so they can be activated. And like here, daily use of propranolol, that is antagonist, will lead to the upregulation. So because like like when you go to the restaurant and then there is no food left, so when you arrive at the restaurant and they tell you that we are so busy that we don't have any food left, so please return tomorrow. But then you go to the nearby supermarket and buy additional food and bring your own food, and then you can eat the food. So this is the way the body, when all the receptors are busy with the, for example, with the antagonist, but still there is no response, so the body will produce additional receptors so they can make a response. So this is adaptation for the lack of the response. So actually formoterol and isoproterenol is agonists. That is why they will decrease the number of receptors, vice versa. So activity of neurons is actually will lead to the more release of the epinephrine, and the daily use of amphetamine that will produce more agonists. So norepinephrine is an agonist, and that is why it will down regulate the receptors. So all these will down regulate. Okay, I think that's all for Saturday's morning. And do you have any questions?
No, thank you.
No, thank
So
you.
How is the test going to be like?
test, I will ask you online.
Like an oral discussion?
Yes,
Like a control work or just a test?
just control. So it's not a MCQ. So I will ask you questions like what is agonist, what is antagonist. So you will answer, and you will need a
Okay.
camera. So I will be so I
Is
can.
there is there a list of questions like there was in botany?
There is no particular list of the questions, but I will ask everything that is in the chapter. So if you want a questions like you get the chapter, for example, therapeutic index. So question is, what is therapeutic index? Then clinical usefulness, what is the usefulness of therapeutic index, etc. So actually you can get this that in bold you can make questions from them. So what is competitive antagonist? So you should explain what is it. What is irreversible antagonist? You should explain what is it, like etc. So what is a full antagonist? Questions are simple, answers
And
are
only chapter 2 or chapter 2 or more?
1 and 2, two chapters.
Okay.
So you have your plan. In the plan there is a list of classes for the 3 semesters. For the 1.5 year is already written, so you can look and plan your time so you get your knowledge. Any questions for the today's topic, or yes, for last week's?
No, thank you, teacher.
No. So if no questions, then thank you very much for attending and for the questions. I hope you like the discussion after as well. So and know a little more about the dating now. So and there is some common things with the receptors and agonists. So see you next week, and please prepare for the test, and good luck.
Thank you. Bye.
Thank you.
Thank you.
Bye bye.
Bye.
Bye.